expenditures. Residents of other congregate settings, such as correctional facilities and homeless shelters, with a known COVID-19 exposure may also be vaccinated in order to avoid delays and missed opportunities for vaccination, given the increased risk for outbreaks in these settings. However, where feasible, precautions should be taken to limit mixing of these individuals with other residents or staff, except those essential for the provision of vaccination services, who should also employ appropriate infection control procedures. Next slide. Next, I'll review vaccination of special populations. Next slide. Pfizer-BioNTech COVID-19 vaccine may be administered to persons with underlying medical conditions who have no contraindications to vaccination. Phase 2 to 3 clinical trials demonstrated similar safety and efficacy profiles in persons with underlying medical conditions, including those that place them at increased risk for severe COVID-19, compared to persons without comorbidities. Next slide. Persons with HIV infection, other immunocompromising conditions, or who take immunosuppressive medications or therapies might be at increased risk for severe COVID-19. Data are not currently available to establish vaccine safety and efficacy in these groups. However, these individuals may still receive COVID-19 vaccination if they have no contraindications, but should be counseled about the unknown vaccine safety profile and effectiveness in immunocompromised populations, as well as the potential for reduced immune responses and the need to continue all current guidance to protect themselves against COVID-19. Next slide. There are no data on the safety of COVID-19 vaccines in pregnant women. Animal developmental and reproductive toxicity, or DART studies, are ongoing and results are expected to be available soon, and studies in humans are ongoing and planned. mRNA vaccines are not considered live vaccines. They are degraded quickly by normal cellular processes and don't enter the nucleus of the cell, as Dr. Cohn mentioned. Observational data demonstrate that while the absolute risk is low, pregnant women with COVID-19 have an increased risk of severe illness, including ICU admission, mechanical ventilation, and death. Additionally, they might be at an increased risk of adverse pregnancy outcomes, such as preterm birth. If a woman is part of a group, such as healthcare personnel, who is recommended to receive a COVID-19 vaccine and is pregnant, she may choose to be vaccinated. A discussion with her healthcare provider can help her make an informed decision. Next slide. Pregnant women and healthcare providers should consider the level of COVID-19 community transmission, her personal risk of contracting COVID-19, the risks of COVID-19 to her and potential risks to the fetus, the efficacy of the vaccine, the side effects of the vaccine, and the lack of data about the vaccine during pregnancy. Pregnant women who experience fever following vaccination may be counseled about taking acetaminophen as fever has been associated with adverse pregnancy outcomes. Acetaminophen may be offered as an option for pregnant women experiencing other symptoms as well. Routine testing for pregnancy prior to receipt of COVID-19 vaccine is not recommended. Next slide. There are no data on the safety of COVID-19 vaccines in lactating women or the effects of mRNA vaccines on the breastfed infant or milk production and excretion. As mentioned, mRNA vaccines are not live virus vaccines and are not thought to be a risk to the breastfeeding infant. If a lactating woman is part of a group, such as healthcare personnel, who is recommended to receive a COVID-19 vaccine, she may choose to be vaccinated. Next slide. Now I will review some considerations for patient vaccine counseling. Next slide.